Welcome to the San Francisco Bay Area Advanced Practice Center's presentation on the SPIVA Toolkit. This presentation will focus on the first half of our 7 Steps for Highly Effective Surveys methodology. The San Francisco Bay Area Advanced Practice Center is part of a larger network of APCs across the United States. This network of APCs is funded by the National Association for County and City Health Officials. The San Francisco Bay Area APC has 2 products, including the Infectious Disease Emergency Response, or IDER Toolkit, and the Seasonal and Pandemic Influenza Vaccination Assessment, or SPIVA Toolkit. Both can be found online on our website at www.sfbayapc.org. This presentation will focus on elements of the SPIVA Toolkit. Within the SPIVA Toolkit, we discuss taking an incremental approach to conducting community assessments. We talk about how key informant interviews, focus groups, and community surveys can be used individually or together to provide a clearer picture of the community that your public health agency is trying to serve. Objectives for our presentation include describing how surveys can build on interviews and focus groups as an assessment tool, to present an overview of our 7 Steps for Highly Effective Surveys methodology, and to discuss the first 3 steps of that methodology in detail, including how to define survey goals, choose a study design, and choose a sampling method for your study. Community surveys are a method for collecting population-level information that can reveal trends, attitudes, opinions, and knowledge in the community. While they can bring quite a good deal of information to you, they require careful planning and development. Our 7 Steps for Highly Effective Surveys methodology includes defining your survey goals, choosing a study design, choosing a sampling method, designing your questionnaire, pilot testing your survey, conducting your survey, and finally communicating the findings from that survey. In this presentation, we'll be focusing on steps 1, 2, and 3. Step 1, define your survey goals. Before you can begin your survey, you need to consider a number of questions. You need to consider the importance of the questions that you're going to ask. And you also need to think about how you're going to end up reporting the data from your survey and how you might use summary statistics in that report. You also need to consider who will be surveyed, who the target audience for your survey results are, and who the primary stakeholders for the issues surrounding your survey are. Step 2, selecting a study design. Generally in public health, we use 3 types of study designs. Cross-sectional studies are conducted within a population at a single point in time. Cohort studies follow a certain population over a period of time. And case control studies divide a population into cases and controls to assess how different exposures might have different health outcomes within that population. Both cohort studies and case control studies are generally used to answer analytic questions. For the purposes of the SPIVA Toolkit and this presentation, we'll be focusing on cross-sectional studies, where we collect information at a single point in time from a target population. A good example of this would be conducting a vaccination clinic exit survey at a local vaccine clinic. Cross-sectional studies can also focus on other populations, including members of certain health plans, or members of different communities or neighborhoods. But for this presentation, we'll continue with our example of vaccination clinic clients. Once you've chosen your study design, you need to start thinking about your sampling plan. A sampling plan ensures that the findings from your survey represent the larger population you're hoping to describe. A sampling plan generally has 2 components: your sampling design and sample size, which include deciding the pattern or method in which you'll select members from a larger population of interest, and also ensuring that you have enough people within your survey to make inferences about that larger population. The second step is developing your selection and recruitment protocol, which is essentially figuring out how you're going to choose actual people and get them to take your survey from that population. When you're designing your sampling plan, you need to consider the different population levels that are involved. The general population for a vaccine clinic might be the entire town that clinic is seeking to serve. Your target population would be those who actually arrive at the clinic and get vaccinated. Your sample population would be those who arrive at the clinic that you actually give a survey to. And finally, the respondents, the smallest population, would be those who received a survey and actually filled it out and returned it to you. When designing a sampling plan, our key take-home message is to ensure that your respondents reflect the target population. With the example of influenza vaccination clients, you can see that the members of that group might overlap with other communities that you might seek to survey, such as health plan enrollees or community members. For the purposes of this presentation, we're going to continue with our example of vaccination clinic clients. There are a few more terms we want to be familiar with when talking about sampling. As we mentioned, our target population is everyone that shows up to our vaccine clinic. But how do we know who those people are? Generally, we know who these people are by looking at our frame population, which is most often a list of everyone that's attended the clinic. But very often when we're trying to conduct a survey, our frame population and our target population don't quite match up. And this is where we discover the terms undercoverage and ineligibility. Undercoverage refers to people who may have arrived at the clinic and been vaccinated, but for one reason or another are not included on the list that you're working with. Ineligibility would refer to just the opposite, individuals who are on your list, but for one reason or another did not come to the vaccine clinic or were not vaccinated, and thus they're not of interest to you because they don't fit your target population. Once you're familiar with these terms, you need to think about how you're actually going to choose people from your target population to be a part of your sample population. There are a number of methods to do this, but for the purpose of this presentation, we'll focus on a method called simple random sampling. Other sampling methods are discussed at length in the written SPIVA toolkit, which is available on our website. Looking at the diagram here, you can see that out of 36 clients that came to the clinic, we've chosen 6. They become our sample population. Next, we'll discuss how we actually chose them. This is where our selection and recruitment protocol comes in. Questions you need to consider for this are how your survey will be administered. Will it be a paper survey? Will it be given electronically? Or will it be conducted with an interviewer? And in the case of other types of surveys, you may wish to follow up with that population more than once. But for our vaccine clinic example, we'll only be contacting our population at a single point in time upon their exit from the vaccine clinic. Another important thing to consider when you're talking about sampling is to consider incentives. Incentives can help people be more willing to take your survey. In our vaccine clinic example, we've chosen every 6th client that came through the vaccine clinic, and thus we had those 6 out of 36 clients in the previous diagram. Since we're administering an exit survey, we only need to survey these people once. But if we had decided it would be important to follow up with them, we would need to clearly explain that this was part of our survey protocol and that they would be followed up with at a later point in time. Very often you want to include incentives to make people more willing to fill out that survey. And so in this example, we've entered our respondents in a raffle. So to review steps 1 through 3, we've learned to define the goals of our survey, choose a study design for our survey, and develop a sampling method that ensures that our sample population is representative of our target population. By using these methods, public health practitioners can inform planning, marketing, and risk communication activities, and ensure that they do use an incremental and continuous planning approach for more efficient preparedness efforts. These efforts can be applied to both seasonal and pandemic influenza vaccination campaigns, as well as a number of other public health activities. This concludes our presentation for the SPIVA Toolkit. More information can be found on our website at www.sfbayapc.org.